Hey, howdy, friends. It's Steve DePoe here with the Rose Realty team with this week's real estate vlog from North Texas. Hey, but before I get started, hey, a little bit of mea culpa, right? I recognize the fact that a couple of weeks ago, what I did was I sent out the unedited version of my vlog, and yeah, that was sort of a mistake. We never want to do that again. So my apologies. We'll do better in the future. Hey, so this week our topic is healthcare in North Texas. Let's get right into it because there's some really interesting facts about healthcare in North Texas if you weren't aware. So we have diverse healthcare systems here. We have several major brands, you may want to call it, Baylor Scott and White Health Systems, Health Resources, and Methodist health systems. Hey, they provide like this comprehensive healthcare system, including mental health, oncology, natal, prenatal, all of those kinds of things. As well as the normal things of broken legs and sprained ankles and all that kind of stuff. So it's a pretty comprehensive and well thought out system that we have here. Hey, before I go any further, please do us a favor and subscribe to our YouTube channel. It's youtube.com at moving to Dallas. We appreciate it. That would give you updates on the videos that we publish, and also would help us out a lot in terms of our rankings on YouTube. So thank you, and we appreciate you. Hey, let's continue with our healthcare systems. So leading medical research and education. So there's several institutions out there: UT Southwestern Medical Center, Texas A&M, University of North Texas Health and Science Center. These basically do research, and they're also teaching hospitals. My sister happens to work for UT Southwestern down in Dallas. And so again, it's this combination of a teaching hospital, you might want to call it clinic, and education and research. So a lot of stuff going on there, especially right there in the hub down there in Dallas, right before you get into the city proper. But a lot of stuff going on there. So it's not just farming and vets, right? Specialized medical facilities. So again, you take a look at UT Southwestern. They're renowned for their research and their development and their treatment plans. Some of the stuff my sister's done is like amazing. Then you also have Cook's Children's, and you have Children's Health, or both leading organizations or institutions for pediatrics and pediatric health. Not only from a teaching aspect, okay, but if you have a child who needs help and whatever area, these are hospitals to go to. They're phenomenal. They're well renowned, and they have a great reputation. The Texas State Office of Rural Health. So let's face the facts that some time ago, North Texas here was so spread out. You had people like 30 miles out or whatever, and where they get in healthcare. So this office was formed, right, to combat the challenges of people living far away from the cities and the more densely populated areas. And they did a combination of went out to make sure people were okay, and advocated for clinics and doctors and those kinds of things, away from the city centers again. And that's what the Texas State Office of Rural Health did. And they had these pop-up, clinics and doctors' offices and those kinds of things, which eventually the sprawl, if you will, and the growth of North Texas and the Metroplex kind of caught up to. But the healthcare stuff was there first. And then innovative health care technology. So hey, North Texas has been become known for some of its innovation. We have a lot of, chip manufacturers in the area, several of them. And so combining healthcare, medicine, and the chip manufacturers, we really went a long way in promoting and progressing healthcare technology forward. It's really kind of a cool thing. Hey, so we've got some really great healthcare providers here. We've got some really great hospitals, some of the best in the country. This just kind of highlights the strengths and a little bit some of the challenges that Texas faced at one point. But that maybe helps you understand what we have out there. And my wife, asking my wife and I have this conversation about, when we retire, where do we want to go? And I keep on wanting to go like off into the woods someplace and like, just unlax, as long as there's a golf course around. But she always thinks two steps ahead of me and figures we have to be someplace around healthcare and all that kind of stuff. And you can do that almost any place in North Texas. You're around a hospital or a clinic or a doctor or something like that. So I hope that was helpful. Hey, next week we're going to get a little bit more defined, and we're going to talk about healthcare in Denton. Okay, so those of you that want to thinking about moving to Denton as opposed to the overall Metroplex, those of you thinking about moving to Denton, healthcare in Denton is coming up next week. This is Steve. I am with the Rose Realty team. See ya.